Let's conclude our three-part series on dental causation of headaches. Roll that intro. What's up, everyone? Dr. Eric Jackson here. Hope you're doing well. Welcome to the third of the three-part series on dental causation of headaches. In part one, we talked a little bit about the background of headaches, primary versus secondary headaches, causations. We advocated that a patient always talk to their primary care physician because there's lots of medical causations of headaches that a dentist cannot treat and should not treat. But then we talked about in part two, which I'll put links to these all above and below in the description. So in part two, we talked about the three most common causations of secondary headaches, dental causations of secondary headaches. I termed the first one dental maladies, things like toothaches, broken teeth, infections. The second one, dental malocclusion, aka teeth that are out of place, or a bad bite, bite issues. And then part three, grinding, clenching, and TMJ problems. So today, what we're going to do, now that we've identified those three issues, let's figure out what can the dentist do to address each of those, right? So, number one, dental maladies. Dental maladies are cured with dentistry. Treatments like fillings, root canals, extractions, they can all remove the cause of the secondary headache. They can all remove the dental problem. And typically, once that cause is removed, whether it's the cavity that gets a filling, whether it's the tooth that gets a root canal, or the wisdom tooth that gets extracted, the headaches will lessen or even cease. Dental malocclusion can be addressed sometimes without any issue. Sometimes the body just wears itself down a little bit and addresses it slowly and surely on its own. If there's always one spot that's hitting a little harder than the rest, you bring it up to your dentist and he or she can adjust that down a little bit. That can sometimes be a very straightforward adjustment. A comprehensive full mouth equilibration is anything but simple. It's a very complicated procedure. And so it depends on the severity, but that can actually be quite a nice way to assist the body in speeding up the natural process that we discussed prior. Essentially, both ways describe leveling the bite. We want to be level, we want to be even distribution of force. Another way to do it without altering the teeth is to orthodontically move the teeth. You want to move the teeth into in the proper position, the proper relationship, top, bottom, left, and right. And that way you don't have to adjust the teeth in any way physically with a drill. You can actually keep them intact and move them appropriately. Now, this can be accomplished a multitude of different ways. Conventional braces and brackets with the wires. You can do Invisalign aligner type therapy. You can do removable appliance therapy. All of these type of orthodontics works for different situations, of course. That's why there's an entire field of orthodontics. Speak to your dental provider, speak to your general dentist, speak to your orthodontist. They'll figure out what's best for your case. But the ultimate goal is going to be, again, even distribution of force, proper alignment, proper relationships with the top, bottom, left, and right, and that way you'll have a better form and function to your mouth. The third causation category we spoke about was bruxism, clenching, and TMJ problems. We'll kind of combine those separate but similar maladies into one discussion here. Bruxism, if you recall, is the fancy word for grinding. Well, what can we do about that? Well, my very first stop is always discussion about a night guard. A night guard is one of my favorite dental appliances, dental procedures to perform. And why might that be? It's not exactly a fancy or exciting type procedure, right? Well, it's exciting for those that really need it. You'd be amazed at I'm going to use the phrase life-changing at times results that you get when you find a patient who has really needed a night guard. Perhaps they were resistant. Perhaps they didn't think they really needed it. Perhaps they were unsure. And then they try it out and the eyes open and then they never want to go to bed without it again. In addition, I love night guards because they satisfy my triple play rule. I formed the concept of the triple play rule back when I started as the team dentist for the Chicago Bandits professional softball team. And one of their players in my first season there turned to triple play. And I thought that's a pretty unique type thing, right? How does that apply to dentistry? Well, my definition of a triple play in dentistry is any procedure that can satisfy three main items: low cost, low invasiveness, high return on investment, high success. Now, a night guard is absolutely a triple play in dentistry. It is zero invasiveness, right? We're not going to adjust the teeth. We're going to take molds of the teeth and we're going to fit something over the top that is removable. It can be worn or not worn if the patient desires. It is low cost. It's far less than any real significant dentistry. You're talking about orthodontics. You're talking about generalized equilibration. You're talking about dental implants and dentures, and everything is usually a lot more than a night guard. And finally, it works. The high return on investment. Night guards are wildly successful for a great number of patients. Do they always take the symptoms and bring them down to zero? No. Often you'll get a reduction in symptoms, perhaps not a resolution in symptoms. But really, a night guard, because it's low invasive, low cost, and high reward, is a great starting point for a lot of these types of cases, especially when you're talking about headaches. Incidentally, what are some other triple play type procedures and items in dentistry? There's a lot of them, and I'm sure you can think of more, but ultimately what I like, Sonicare type electric toothbrushes, Oral-B toothbrushes. They are zero invasiveness, low cost, high ROI. Sealants, dental sealants, zero invasiveness, low cost, high ROI. Listerine Total Care Zero. I love Listerine Act, fluoride type treatments, right? Zero invasiveness, low cost, high ROI. All three of these types of things are fantastic. And that's why night guards and headaches go hand in hand. It's a great way to do it. Now let's talk a little bit more about night guard. You have the over-the-counter version and you have the custom version, right? An over-the-counter version will give you a lot of benefits. Sometimes it's looked down upon. It's frowned on in the dental field. But I don't. It's a useful tool, right? If you're experiencing headaches and you just can't get into the dentist, or you don't want to go to the dentist, you should go to your local pharmacy. Go grab you'll spend $25, $35, and get an over-the-counter nighttime grinding night guard, right? You're going to be able to then take it home, put it in the boiling water, put it in the microwave, follow the directions, whatever it happens to be, and you'll have it. You can have it within half an hour, depending on how close you live to the pharmacy and how fast you can boil some water or use the microwave. The dentist cannot get you a custom night guard in that short amount of time. It's a very valuable tool to have in your back pocket, and you'd be surprised how many people don't really know it exists there. They will tough it out, they'll suffer through it, and they really shouldn't, and they don't have to, more importantly. It does have some common negatives, however. It is bigger and bulkier. It's harder to breathe with. You're not going to be able to talk with it very well. It's kind of more akin to a big, bulky sports mouth guard, right? The kind of, think of like a boxer's mouth guard, a really thick, big one. Not all of them are shaped that way. I'll point out when I'm dealing with these types of over-the-counter ones, I really kind of default to the horseshoe shape. There's several different other styles, but I really like the horseshoe shape, the maximum coverage of the bite surface. That will give you the most predictability, and then you'll be able to have an easy transition, if you like it, to a full coverage custom-made one, which is a great segue here. Why is a custom-made one so much better? Well, it does everything the over-the-counter one tries to do, and a lot better, obviously. It stays in better. It's thinner but stronger. It's smoother. You're able to. It's not going to flop down as easily. I like to call the over-the-counter night guards semi-custom, but that's a big difference, a big jump to full custom from the dental office. The impressions that are taken by your dental team are impeccably more accurate, and therefore will have impeccably better fit than anything you can get at the local pharmacy. So why does a night guard work, in fact? Well, ultimately, think it back to what we just talked about. It's not going to address infections. It's not going to address broken teeth. So, category 1, causation, category 1, it's not really meant for that. But it does work very well for category 3, the TMJ issues, the grinding, the bruxism grinding issues, and the clenching issues. That's bread and butter for it. It can also help with the dental malocclusions, right? If you have teeth that aren't exactly in line, perhaps some are higher and lower, whatnot, having a full coverage mouth guard helps to literally even out the playing field. And that way, you're not banging into one tooth prematurely. The tooth that's out of position is going to have a chance to glide over the top, and you're going to be much safer and much less prone to breakage or fracture. In addition, if you're a clencher, you're going to get extra space. It's going to help with your TMJ as well. So it helps with the grinding, but it also helps with the clenching. The extra, think of it as a bicycle helmet for your teeth. You're going to have a little bit of padding, a little bit of extra space on the bite surface of the teeth. So when you're crushing down at night, or frankly during the day, you're crushing down anytime, you're not going to be tooth on tooth. It's going to have a little bit of give in between. It's going to have a little bit of separation in between, and that give will help your jaw joint. That separation will help your jaw joint from being overloaded, overworked, and really that's just kind of the name of the game here. We're buffering the excessive use of your jaw muscles and therefore your jaw joint and your head and neck muscles. So obviously I've gone on heavily about the night guard. It's one of my favorite devices. If you have any inkling that you might suffer from any of these types of issues, these top 3 issues, talk to your dental professional about a night guard. It might be right for you. You can always go to your local pharmacy and try one out. You don't need a dental professional for that. Know the limitations of the over-the-counter versus the custom, like we mentioned earlier in the video, and then see what happens. You can't go wrong with open communication with your dental team. That is what modern dentistry is all about. So in summary, if you suffer from chronic headaches, of course, talk to your medical provider. Your primary care physician is your first stop, but don't forget about your dental team. Your dental team will probably have some fantastic insight into your specific case, your specific teeth, positioning, a history, and give you a lot of insight. Don't forget about your night guard. Try out an over-the-counter night guard if you wish. If you want to just run and go for it, it's a very good use of $25 or $35. Thanks for watching. I really appreciate it. I love doing these 3-part series. They are a great way for me to give a very in-depth view into a topic that, frankly, I could talk about for a whole day. But this way, you're able to get a little bit more than just a single video. As always, if you like the content of the channel, please go ahead and subscribe. When you do so, hit that bell so that way you get notified whenever I upload another video. Like the video, please. And of course, comment. Put all your comments and questions down below. I love hearing from you guys online. It's a real joy. Thanks so much. I'll talk to you in the next video. Have a great rest of your day. Bye now.